Hi all, welcome to some important multiple choice question discussion session. We have already completed some mock tests, around 100 mock tests, and the answer key was not detailedly discussed till now. So let us go to the answers of some important multiple choice questions in previous year exams. First question, which one of the following is an example of afferent nerves? Option A, trochlear nerve, B, abducens nerve, C, vestibulocochlear nerve, and D, hypoglossal nerve. Here the answer is vestibulocochlear nerve. For answering this question, first we have to see what is afferent and what is efferent nerves. Sensory nerves are afferent nerves and motor nerves are efferent nerves. Now you have to remember the chart of cranial nerves. There are 12 cranial nerves which are arranged in color codes for identifying which is sensory, which is motor, and which is mixed one. So here you can see the green color for the sensory nerves, which are olfactory, optic, and vestibulocochlear. Blue is for the motor nerves, oculomotor, trochlear, abducent, accessory, and hypoglossal. The mixed color is for the mixed nerves, which are nerve number 5, trigeminal, facial, glossopharyngeal, and vagus. So just remember this color code for remembering easily what is sensory, what is motor nerves, and the same for afferent and efferent nerves. Next question. Which of the following medication is administered sublingually for managing angina pectoris? Angina pectoris management is concluded in monotherapy, that is morphine, oxygen, nitroglycerin, and aspirin. In that, sublingually given medicine is nitroglycerin. You can see the chart for monotherapy for easy remembering of all this medication. Morphine, this is an analgesic. Oxygen for hypoxia or ischemia. Nitroglycerin sublingually for ACS or MI. Next question. The gland which is also known as suprarenal gland is pineal, adrenal gland, thyroid gland, thymus gland. See, the suprarenal gland is adrenal gland, the gland which is situated above both kidneys. So the meaning of suprarenal is above kidneys. Next question. A chronic alcoholic patient blames his family environment for his alcoholism. Which of the following defense mechanism was used by the patient? A, denial, B, projection, C, rationalization, and D, sublimation. Here the answer is rationalization. You can see the differences. Rationalization is a defense mechanism in which an individual justifies his failure and socially unacceptable feeling by making excuses or formulate logic reasons. Examples are: husband does not enjoy the company of wife outside the home, usually leave his wife at home, and give logic that his wife is socially shy. So this kind of examples are for rationalization. But wherein sublimation is a similar type of mechanism, but the difference is they will channel the unwanted or unacceptable urges to admissible or productive outlet. Example is a woman who recently went through a breakup may channel her emotion to a home improvement project. So this is a productive project. So she is changing her unacceptable behavior or urges to a productive or acceptable urge. Projection, this is another defense mechanism. It's a form of defense in which unwanted feelings are displaced to another person. That is completely taking away from one person to another person. For example, a person who is having an affair may accuse their partner for infidelity. So one person is already having an affair, but he is just displacing or projecting this to his wife to justify or defend. So displacement is another mechanism, but displacement, the difference is in the displacement the feeling or the acquisition will be, or the expression will be going to a third person. For example, if your boss was angry at you, then you cannot react to him. You will try to find a less threatened object or less threatened person. When you go home, you will unnecessarily scold the children. So this is displacement. But projection is when a person is having an affair or any kind of issue. So the person who will question the affair will be your partner, right? So you will just project it to the partner itself so that you can justify it. So this is the differences of sublimation, projection, displacement and rationalization. What is the temperature used for autoclaving? 101, 121, 130, 125. These all are degrees Celsius. Here the answer is 121 degree Celsius. See the chart here. Autoclaves are used saturated steam. The measurements are 15 pounds, 250 Fahrenheit or 121 degrees Celsius. See here the chart. Pressure 15 psi, temperature 121 degree. Timings depends, but most of the time it will be 15 to 30 or 30 to 1 hour. What is the other name of fear of death? Thanatophobia, claustrophobia, acrophobia and thalassophobia. I think you already had a session here. Fear of death is thanatophobia. Claustrophobia is the fear of closed spaces. Acrophobia is the fear of height. Thalassophobia is the fear of sea travel. Which is the nosocomial infection? This is a application level simple question. The answer is infection acquired from the hospital. That is nosocomial infection. Infection from animal sources, zoonotic diseases. Infection from mosquito bites is vector-borne diseases. Acquired from home is domestic diseases or community acquired diseases. The most suitable position for giving an enema, this everyone knows, that is left lateral position. Which purgative causes hypokalemia? Castor oil can cause hypokalemia, which is a laxatives. Normally laxatives can cause hypokalemia because the laxative will pull out the sodium and potassium also from your body. Which condition is identified by Ziehl-Neelsen technique? Malaria, syphilis, tuberculosis and typhoid. Here the answer is tuberculosis. You should know the other name for Ziehl-Neelsen stain, that is acid-fast bacteria stain or AFB. So when you know this term, this is more familiar for the people who are already working in the hospital. So the answer is tuberculosis. What is the end product of proteins? Amino acid, triglycerides, fructose and glucose. Here again about the protein digestion, fat digestion and carbohydrate digestion. Amino acid is for the protein digestion, triglycerides from fat digestion, fructose, glucose and all for the carbohydrate digestion. Positive Chesstock sign is for hypocalcemia, hypercalcemia, hypokalemia, hyperkalemia. See, this is for hypocalcemia. Chepstow-Skine is the abnormal twitching of muscles that are activated by the facial nerves. You can see the diagram here. This is process when you are putting a BP cuff on. The other one is Chepstow-Skine for the facial nerve or nerve number 7. The lining of nose is with which type of epithelial tissues? Simple squamous, stratified squamous, ciliated columnar, and transitional. The answer is ciliated columnar. You can simply see the linings of areas where the movement of small particles are there. You can see like sperm duct, nose lining, trachea, bronchi, kidney tubules, respiratory tract, oviduct. All these areas are lined with the ciliated columnar epithelial tissues. Osteoporosis occurs due to the deficiency of phosphorus, calcium, zinc, iron. This is a very direct, simple question. This is the answer is calcium. Which is an affective disorder? Phobic anxiety disorder, bipolar disorder, somatoform disorder, schizophrenia. Affective disorder is the psychological disorder characterized by abnormalities of emotional state and which include major depressive disorders, dysthymia, bipolar disorders. So here the answer is bipolar disorders. The memory disorder that affects older adults is, this also a simple direct question, insomnia, dementia, dyspnea, dystrophy. Dementia is the right answer. The term toddler refers to from birth to 1 year, from 1 year to 3 year, 3 year to 6 year, birth to 1 month. Here you know the toddler is 1 to 3 year, birth to 1 year is infant, birth to 1 month is neonate, and from 1 month to 1 year is infant. 3 year to 6 year is preschooler. How many pairs of chromosomes are present in human cell? This is also simple basic question, but the answer is 23. You have to be careful to not jump into 46 because here the word is pairs. So you have to stick on 23. Some people will go to 46 and make mistake. Which among below is also known as lipid that is necessary for normal transport and utilization of other lipids, especially in the liver? Cardiolipin, lecithin, cephalin, plasmogens. The answer is lecithin. Lecithin is an amphiphilic lipid which will have affection towards water as well as lipid. Which among the following is an example of crystalloids? This is a very simple question. All other: A is RBC, B is WBC, C is plasma, D is ringer latate. All other options here are related to blood and blood product. So here the ringer lactate is crystalloid. The glial cells that forms the myelin sheath of axons outside the brain is option A astrocytes, B Schwann cells, C oligodendrocytes, and D ependymal cells. The answer is Schwann cells. Here you see the glial cells that forms the myelin sheet on axons outside the brain is Schwann cells and inside the brain is oligodendrocytes. Which method is collaboration in providing care to a group of clients under the direction of professional nurse? Modular method, case method, primary method, team method. Here the answer is team method, because in team method a professional nurse will observe the team members to execute the plan. Example for team method is, if you can say, a resuscitation process. In a resuscitation process, all the staff will be available and one team leader will coordinate the resuscitation nursing activities. Modular method is a modified method of the functional or team method. Case method is ideally one staff is assigned to one or more patients, so the staff will do the comprehensive care of only that patients. This kind of methods will be seen in ICUs. So here the answer is team method. Memory traces are present in mind in the form of option A diagrams, B engrams, C pictures, D signals. Here the answer is engrams. The memory traces are present in the mind in the form of engrams. Malignant tumor of testis is known as A melanoma, B seminoma, C lymphoma, D Wilms tumor. Here the answer is seminoma. Which is the neurotransmitter responsible for sympathetic vasoconstriction? A angiotensin, B epinephrine, C norepinephrine, and D serotonin. Here the answer is norepinephrine, which will act on the alpha-1 adrenergic receptor to form sympathetic vasoconstriction. Which is an example of gram-negative organisms? Listeria monocytogenes, Streptococcus pneumonia, Vibrio cholera, Staphylococcus aureus. Here you can see the answer is Vibrio cholera, and I will give you one simple tip here. It's a memory tip actually. Here you see all the options which are having the letter S is positive. You observe here Listeria monocytogenes, that is S is there. Streptococcus, Staphylococcus, so this S is having positive, S positive. Here also S also positive, also having an S, right? So you have to find a link like that to remember for the future. Vibrio cholera is negative. The road to health card is used to A monitor growth, B provide nutrition, C provide preventive care, and D care illness. The right answer is monitor growth. See here, road to health chart used by the pediatrician and other healthcare professionals to follow a children's growth. 28th question. The meeting point between coronal and sagittal suture is known as A parietal eminence, B occipital eminence, C brecma, D lambda. Here you can have the answer as brecma. See the diagram to identify. This anterior fontanelle is the brecma and posterior is lambda. You can have a memory tip or shortcut. BAD 12 to 18, LPT 1 to 3. See the expansion, brecma anterior diamond shaped fuses at 12 to 8 months. So this sentence will cover 4 questions. BAD 12 to 18. Then LPT 1 3. lambda is posterior, triangular shape, fuses at 1 to 3 months. So always try to remember like this kind of short forms, which will help you to cover many questions from a single word. Difference between systolic and diastolic blood pressure is known as A. Peripheral vascular pressure, B. Central venous pressure, C. Pulse pressure, and D. Hydrostatic pressure. I think everybody knows this simple answer, that is pulse pressure. Pulse pressure is systolic BP minus diastolic BP, and you see the formula for mean arterial pressure also, MAP. MAP is diastolic BP plus 1 by 3 into pulse pressure, or 1 by 3 into systolic BP minus diastolic BP. The last question for this session is false perception with stimuli is also known as hallucination, delusion, illusion, and mania. Here the three terms, hallucination, delusion, and illusion, you have to check. The right answer is illusion. We will see all the options one by one. Delusions, this is the false belief. This is the problem of belief or thought process or cognition. It is a false belief, that is delusion. Hallucination, there is no external stimuli. Without a external stimuli, there is false sensory perception, that is hallucination. Illusion, there is a stimuli but with perception of the external stimuli, that is illusion. So delusion is a perception issue, it is a thought process actually, it is a cognition issue, it will be a false belief. Hallucination, absence of external stimuli, false sensory perception. Illusion, false perception in the presence of a real external stimuli but misinterpretation. So I am winding up this topic now. More multiple choice question and their answer key will be discussed later on. This is my first kind of video in this segment, so there will be some kind of gaps or technical glitches will be maybe present. Please cooperate with this. We will try to improve this and come up with better videos. Thank you all for watching this video. Please like, comment, subscribe, and stay tuned in this channel for more videos. Thank you.